Well, should I start off with what? Okay. So my name's Rhonda Potter, and I am also known as Sugar Be Real. As of this year on Fire Island, I am the reigning homecoming queen, which I'm very proud of because this community has always shown me love. I am an ally, and they really showed me love last year. My whole head felt like it was being squozen in a vice. And then it got very foggy and I could see her mouth moving, but I couldn't hear what she was saying. And then my head popped back open. And when it popped open, and as I'm being wheeled into the emergency room, I heard somebody say, oh, maybe she's having an aneurysm. And my immediate response was like, who does that? I'm like, this is not Young and the Restless. Do you know Young and the Restless?
This is a beautiful, beautiful seasonal community where most people come here to vacation, to be leisure, to escape their life wherever it might be in New York City, on Long Island, Philadelphia, Washington, and just to come and relax and have fun, be at the beach, be at the ocean, be with friends, be with neighbors. So the last thing anyone wants to think about or be fearful of is their health.
Organized medical care began almost 70 years ago here in Cherry Grove. It became very obvious that as the community was changing and growing, having volunteer physicians was not something that would sustain the house any longer.
We've always had doctors here, but we needed a community medicine program. We probably have 500,000 visitors that come to Fire Island on a yearly basis, and I'd say most of those visitors come within like 3 months. If we don't have a doctor on the beach, then it could be hours before somebody can get to a doctor's office to see a doctor.
I personally had 2 TIAs, or strokes, over at Cherry Grove. When I first started going over to the Grove, there wasn't any medical care over there. And I had to kind of wait through the night to get off the island to get to the hospital.
Patients and community members would have to hop on a ferry to get treatment. They'd have to hop on a ferry to get medication refill. They'd have to hop on a ferry for anything.
It gave me that reason to really grow this.
So I've heard time and time again, you know, Northwell being here really makes a difference. I'm so glad you guys are here.
It's amazing. If you come here at any given time and you visit one of our practices, you'll see people lined up, ready to see the provider. And it'll range from everything from a headache or a cut or a bee sting or a fracture. In some cases, we've had emergencies and we've had to airlift people to our South Shore University Hospital, our tertiary care center. So we see a range of things, even just, I need a physical for Kim.
Our goal is to make sure that the quality of care that we provide at the other clinical sites, ambulatory sites across the island and in New York City is similar to what we're offering at these sites.
You get to interact with a physician from the first minute you step into the clinic to the very end. That's probably the most concierge service that I could think of.
I just know that people come here with a sense of calmness, knowing that God forbid if something happens, they're going to be cared for in the best way and the most appropriate way possible.
I feel that Northwell brings consistent quality care because that's the way that we run the whole health system.
They've also implemented surveys to understand what the need is here in Cherry Grove. So for example, we have more families here and they have been instrumental in bringing care to children in Cherry Grove.
One of the things that I see great utility in that we've actually been using, our family medicine docs, is point of care ultrasound. Anecdotally, I had a patient who was earlier in her pregnancy. She fell at home. She was really worried. She didn't know, okay, is my baby okay? And we were able to just place the ultrasound, find the baby's heartbeat, and her whole affect just like changed. She was so grateful.
So it gave us a little bit more of an insight now to helping the providers out and to not let them feel like they're on Gilligan's Island. So we really try to give them that lifeline.
This is a really special community, and Northwell has embraced this community, has done just so much good for our community, given us a sense of pride, hope, and everyone knows that they can rely on Northwell to give them the quality care that they need and deserve.
So when Northwell came to the Pines and said, we are here to give you the Mpox vaccine. People who were here to relax, to vacation, to enjoy, to be LGBTQ in this environment. Northwell came in and gave us the opportunity to feel the safety and security with those Mpox vaccines that we otherwise would never have been able to experience.
So being in Fire Island is just part of the DNA of Northwell, and expanding our services here as the community needs it is just part of what we do. I mean, look at this place. It's amazing.
But Northwell also sends over its employees to clean up our community, to actually go through the community with sticks in hand, bags in the other, and picking up trash.
When we have our Gay Pride Parade here in Cherry Grove, they walk shoulder to shoulder with the queer community, and they're proud to do it. They're part of us now.
There are no words to express the gratitude we feel in this community for having Northwell and their practitioners here with us.